Hello, my name's Lesley Batchelor, and I'm fortunate enough to be the chair of the Paddy Ashdown Policy Research Forum. Every few months, we hold a global conversation, and this month we are lucky enough to have Dr. Linda McGoldrick talking to us about, after the applause, what frontline healthcare workers need now. Dr. McGoldrick is a member of our board of trustees, and she's also on our advisory board. So we're very fortunate to have her. She's recognized leader in life sciences healthcare, mental health, behavioral health, and global health systems. With 30 years experience in C-suite roles, driving strategic growth, innovation, and transformation across the healthcare industry in North America, Europe, and Asia. Her doctoral research was titled The Mental Health and Resilience of Frontline Healthcare Workers Globally, and it reflects her deep commitment to advancing resilience and well-being for healthcare professionals worldwide. Dr. McGoldrick is known for her ability to bridge rigorous academic research with practical leadership, designing and implementing strategies that address the psychological and organizational challenges facing global systems today. Welcome, Dr. McGoldrick.
Well, thank you and welcome everyone.
So, Dr. McGoldrick, there's a growing recognition that health of a nation depends not only on the patients, but on the well-being of those who care for them too. From pandemics to everyday pressures, frontline healthcare workers operate under sustained emotional and physical stress. So I thought we might spend the next few minutes talking about the way in which we can support them and how we can do this better. And I wanted to start with the sort of the state of the frontline healthcare at the moment. And from your perspective, what the current state of frontline workers' mental health globally, and particularly in the aftermath of the recent pandemic. Perhaps you'd like to start with that.
Yes, thank you. Welcome all, and good afternoon, good morning, and good evening, depending on where we are. I think let me just set the stage that um, sort of mental health and resiliency is integral to health, right? It's part of total health. And I think that the topic of mental health and resiliency for frontline healthcare workers globally has not changed. It has just worsened, and there is no silver lining to pandemics. However, it did provide, the recent one of COVID did provide an extraordinary opportunity for the mental health, behavioral health of providers and consumers worldwide to see how extraordinary and extreme the burdens are on healthcare workers. They are the front line. This is all professionals, clinicians, mental health workers, everyone is part of those teams that touch patients. And I think that as we've grown to understand better, there's been greater visibility. The conversation has been um, more robust. So let me maybe identify the statistics tend to run consistent country by country, but just looking at the NHS and the UK, if we look at just top line numbers, if there are like 1.4 million full time staff, about half of them are clinicians. And in 2025, 10% left, right? 10%, and that's consistent in different countries, have left for a number of reasons. But one in three that we can document, one in three that leave, and even talk about the stress and the burnout. And that's an extraordinary number. I'm sure it's underreported. Uh, and I think that this is an extraordinary social, economic, and sort of quality of care issue for patients. Um, I believe that the conversation will only improve and connect the dots with leadership in ministries of health, in hospitals and community clinics, and in the field, with attention to how we support those providers supporting us as patients.
So if we sort of break this down and we just start about where we are at this very moment, where thank you for explaining what it's like in the NHS, but of course
Mm.
you actually worked with, I can't remember how many countries you actually worked with, but it was quite a substantial number, wasn't it? How many was it?
Yeah, so it was 42 in my research time. And it was important to do that for me to understand comparative regions of the world, systems of the world, difference in economics, right?
Of
And
course,
funding that go into healthcare. And then beyond that, what was the state of healthcare workers globally and their mental health and resiliency.
of course. So if you sort of were looking at this sort of just as a overall at the moment, have we learned anything in terms of protecting healthcare workers, or are we liable at the moment to sort of repeat the same systematic failures that we made last time?
I think the recent experience that was, just catastrophic with COVID worldwide taught us a number of things. And it started to, whether it was supply chain and safety and masking, and this is pre-vaccine, during, and then what is it today, right? Because we have vaccines still, but there are social reasons. Some people are currently were early adopters and sustained that for their own care and the care of others. So I think that it has been lessons learned is we now have data. We now see, and people are talking about why they're working, why they're leaving um, healthcare. We saw the intimate challenges of frontline healthcare workers in the pandemic, to implications of what that meant for their families, their immediate communities, their colleagues as part of those teams. And, of course, behavior change. We had to learn what did that mean. And it was extremely difficult. And of course, millions died, right? And the heavy burden of that and the reality of that. So I think that I don't think those challenges have gone away. We need to continue to be prepared to have our attention and priorities to what did we learn and what happened
Mm.
next. We have an immediate example of what just a few weeks ago with the virus on that cruise ship. It was just one example, but that could happen at any time, right? And the implications we see through more disconnected resources with WPO. Certainly, America pulled back funding, and there's a lot of discussion around the implications to the current Ebola outbreak, right? And if you disconnect, it's not just direct funds, it's about the infrastructure around that and labs. So there are many lessons to be learned and more to learn.
So when I'm saying, do you think we're at risk of repeating the same systemic failures? I think you're probably saying we are.
We are.
We are.
We
Well, that's a bit depressing, isn't it? But perhaps
yeah.
if we work through this, we'll get more positive. So
Well, I think,
now,
I think there is a positive note, and then we can move forward. But I think the lessons learned are, in fact, that, right? And
yeah.
the connectivity and the communications. We are a more connected world. We talk about these issues, and there are lessons learned. But yes, we are at risk.
Mm. So what are the most pressing psychological stresses facing healthcare workers to get today across the hospitals, the emergency services, or the community care?
Well, certainly the stress and burnout piece, and that takes different forms, prolonged depression, and you can dig deeper. But if you can't function, you can't take care of your patients. You can't take care of your colleagues on that provision team. It's just not sustainable. And if we can't sustain ourselves and the quality of care provided to patients, then it starts to fall apart. It's an economic argument that good prevention, support, proper care actually is, is good for patients, it's good for sustainability, it's good for economies.
So we'll pick up on that point about the resilience of people. And then we talk about resilience in healthcare workers, but is there a risk of the term itself being used to shift responsibility away from the systems as opposed to, and then put it all the responsibility onto the individuals?
I think we always see that dynamic, right? But the fact is, this is shared responsibility. We need, leadership in ministries of health or heads of health systems, hospitals, community clinics need to understand that if they don't put their providers first, this will not work. And there's endless data to support that, endless data. So it is a sort of a shift in psychology at the top. And I think what I've seen in my research, as well as just observations in different healthcare systems, that it's quite obvious and people understand that we need to support each other. There is a sort of social and moral and ethical piece to this, but the awareness of that has grown. People are more willing to talk about it, to share it, and more overtly support. I think we saw examples, banging pans in the streets during the actual
Demic.
epidemic. But, this goes beyond. This goes beyond. So I do think that there is a light in this tunnel, but not without vigilance on both sides.
Right, yeah. So, I mean, that was one of the questions I was going to ask you if there was any evidence-based approaches that are more effective in supporting mental health of the frontline staff.
I think there is a lot of data. I'm going to sort of describe this in terms of it's also integral to culture, right? How each culture understands and treats mental health and support. There are cultural biases. There are religious biases. There are, it's gender, it's race. There are many different factors that contribute to how patients are cared for and how frontline healthcare workers are sustained. And all of these factors need to be understood in the context of cultural support. Those countries that might, for whatever reasons, have biases, again, cultural biases to not talk about, that it's not talked about, or mental health and resiliency is seen as weakness versus strength. Those countries are the ones most affected and patients lose, right? So
Oh,
you can't have the conversation without stepping back and understanding the cultural context.
of course, that makes absolute sense. But were there any that actually had the better ways, the most effective way of supporting their mental health of the
Mhm.
frontline workers?
Well, I can speak to maybe different regions of the world. The Philippines, for instance, were and are very aware, very nimble in how they responded to the recent pandemic. And there were lessons learned, but the speed at which they adopted, understood, and operationalized their response was extraordinary, and therefore, fewer people died.
That's brilliant. That's brilliant.
Training was shared and recognized.
Yeah.
We could look at. Shall I cite some others or?
Well, no, no, by all means do.
Well,
Absolutely.
I'm thinking of also the difference in, say, South America and, say, Ecuador. Very religious based mobilization, which was, very, as a Catholic country, but extraordinary. Churches stepped up. There was a cultural awareness of taking care of one's own. So with reduced financial resources, they still were very effective in mobilizing and supporting their frontline healthcare workers.
Oh, that's really interesting, isn't it? Um,
Mm.
so what I was wondering was, you know, how can organizations identify slightly early warning signs of a burnout, trauma, or I think they call it a moral injury, is that right? Before they escalate.
Um, I think that there is an awareness just socially. We all know at a personal level how we're sort of feeling the malaise of depression or the malaise and the burden of care or lack of care. So there is that innate sense that we all feel. And if we can continue to sort of advocate and keep a conversation going and demands by leadership at the individual clinic level as well as nationally, then it sort of implores leadership to step up. I think there's a private sector component to this, which is very much in partnership with government. You know, when we looked at PPE and supply chain and how did different systems, different companies step up. And of course, the NGO or INGO communities were integral to that leadership, delivering goods, training, frontline in that sense. So the partnership is a very powerful model between public, private, government, and NGOs.
So, with the healthcare systems being sort of so overstretched and sort of under-supported, is there a sort of a basic strategy that they can approach to really realistically deliver high quality care, if they're under those conditions?
I think that I think we've learned that the if there is an answer is you just keep it simple. You go to where the need is. You provide the support literally to the frontline teams. And it's a cultural and behavioral change as to how we do that and advocate for those. And if there isn't that kind of commitment, and it's not just financial, there is certainly a funding component, but it's also a psychological component. How do we support others, ourselves, our families, our hospitals, and communities? And the trickling up and the top down of that has to be sort of a constant interrelationship and pressure the system.
Yeah. So I suppose sort of leading on from that, it's sort of, what does a healthy workforce practically look like in a functioning system?
Mm.
What shape does this take?
Well, certainly people leaving the field, people leaving is not a good statistic. Burnout is real. And then what, right? Do they go for a period of time, kind of um, work on their own mental health and then come back into the system? Or are they out forever? It's a big issue, a very big issue. So if you focus on the point of care, if you will, and the point of care is holding up, building up, providing services to support, hopefully, one will see the results of exits
Reducing.
reduced and service improved. Patients will have better access, quality, sustainability, and really the sustainability statistics are the bottom line, right? And that is the proof. Um, there's no one solution, there's no one formula, but the variables to achieve that outcome um, are common and then in a cultural context, shared and operationalized in a different
Yeah.
way. Yeah.
And one of the points you made earlier was around training and preparedness.
Mm.
Um, and I was just wondering, how should training evolve to better prepare healthcare workers for high trauma environments such as pandemics, but
Mm.
also conflicts as well, because increasingly we have a lot more conflicts going on too. So how does that training evolve to really encompass all of those aspects?
I think a bright light in looking to current circumstances and future of change is the training. Training has been transformed and needed to be. So deep, deep dives in how, what is depression and how do you treat it? What is stress mitigation? How identifying the factors and creating very pragmatic, highly accessible programs online, in communities, and within, say, a hospital itself. That there are times and space, practical matters of how hospitals change the rules and regs about downtime, right? Downtime on site, taking more breaks. It has transformed how we think about um, the actual training quality and depth and exposure. And anyone can take this. So the accessibility of that is important.
Absolutely. So, do you think it's covered in sufficiently in sort of the nursing and medical curriculums that are addressing the psychological resilience and offering them coping mechanisms?
Mm. Well, it's never enough, right? Because in the greater scheme, mental health has always been the stepchild to quote unquote public health, when in fact it's all one. You can't have one without the other. So that is the goal, and an understanding and recognition of what is health and wellness today. How is that reflected in medical school training, in nursing, in health, all allied health professions, and in the culture of that medical site. Um, and then that is then reflected when, say, there are teams in an emergency preparedness or war zone, how it affects military medics. It has implications throughout the system. So it's not enough, but it is improving. And I think that you can see that reflected in any educational program to adopt that level of sort of preparedness and readiness.
But also, I suppose we have this situation where people are coming through the system and they've learnt, perhaps done their qualifications at,
Mm.
say, 20, 25, and they've passed a certain
Mm.
element of that. So, what role do you think sort of ongoing professional development should play, in sustaining that workforce well-being?
No. Well, it needs to be integral to currency, right? It needs to be, and I do see this. There an awareness. I think for most health-related professions, there is a credentialing and educational um, requirement. So there is a mechanism to do that. There is a mechanism. If we look at the Royal Society of Medicine, particularly, they're very much in the forefront. Other training and professional associations that will prioritize mental health and wellness as integral, and the impact on practitioners and the impact on their patients. And there's certainly a direct line.
So, across the 42 countries that you mentioned earlier, how many of them have sort of formalized CPD programs, or what sort of role did that play in their resilience?
Mm. I think if you look, many do. I'd say 60% do. I think it's also within that sort of continuum of team care. Medical doctors and nurses have more of a credentialing requirement, so therefore they're going to get more, or have access to more, or be have to look into that level of training. And others are it's really individuals that wish to pursue, and that can be influenced by their manager, their team leaders, and their colleagues, right? An awareness that more support's needed. So what are we going to do about it?
Mm.
And it's an area of opportunity, but certainly it's a growing recognition.
So,
Mm.
were there any countries that were better than others?
Uh, I think some of the Western countries, of course, that are a little bit more well funded broadly. There are, of course, exceptions. But if you look at Canada, if you look at some of the initiatives within the NHS, certainly the Nordic countries were very forward thinking as a perspective, and social care is paid for, right? So there's an economic alignment. Um, but I think the extraordinary challenges of the COVID pandemic taught others that in leadership roles in Southeast Asia, South America, in particular, parts of Africa, that there are solutions. There are solutions. And there are models out there that one can look to.
Brilliant. Yeah. Well, I think we've covered a lot of things, but I just wondered if I could pick up on some extra things, which are, policy and leadership and funding. And you sort of started mentioning, of course, that right at the very beginning, quite rightly, that we need to think about how we're leading people through these problems, but of course the funding and the policies need to support that. So, what responsibilities do you think ministers of health and senior leadership carry in safeguarding healthcare workers, and their mental health?
Well, I'm sort of glad you highlighted that, because if you look at any system, country, or social system, it tends to be top down. There's a kind of interesting mix of bottom up and top down. But if the top, in terms of health policy, is held with ministries of health, which it is, that if there isn't an awareness and need for change, it's just not going to happen in a sustainable way. It will come from the middle and the bottom, because there are real needs, and it's patient driven. It's advocacy by professionals. I have begun to see, and one country in particular was extraordinary, Bosnia and Herzegovina, being very much leaders in looking at the actual practical changes they were going to make, and discussions of how to increase funding, national health funding, that covered and recognized the mental health and resiliency component of that. If maybe it's being aspirational, but I am. That will be the ultimate change. That will be the significant change that will completely, change statistics, reduce burnout, and retain highly qualified folks. And patients will get the care they need in time.
Brilliant. So I was going to ask you, how this varied across the globe, and you've picked on Bosnia and Herzegovina, which is really great because of course that was where Paddy Ashdown was based.
Yes.
And we're very glad you brought that up, which is very, very apposite. But I wondered sort of, what's driving this then? Is it just political change each time? I say just because we now know how frightening political change can be. But at the bottom line, is that what we need? We need to make sure that this is a political thing that is always supported.
Um, I suppose the answer is yes, but it's a conversation. It is a conversation and partnership between sort of the entities that I mentioned earlier, because no one operates, in a vacuum. So
Mm.
conversation and drivers come from the medical and health, allied health professions, that has to keep for absolutely moving ahead as a driver. There is tremendous increase and voice of patients and patients' self advocacy, advocacy in their communities, and sort of an integration of the components of those communities. Religion plays a role, right? How one continues a conversation in truly a transparent and um, um, uh, forceful way. The economics absolutely follow and hold up the argument. If you invest in prevention, if you invest early, you will see, outcomes improve for patients. Frontline healthcare workers better upheld and sustained, therefore reduced um, exit from their profession. So it's not a complex formula, but it does take time, right? It does take time. So I think the private sector has seen the benefits of this. The certainly the international NGOs who are on the front line in the most extreme environments 24/7 play a role and have been extraordinary in service and execution. I think the conversation needs to continue as a partnership conversation for the best possible outcomes.
That sounds brilliant. I think, obviously we were very conscious throughout the pandemic we had about the different approaches the different governments took, this sort of top-down approach, which was, particularly in the preventative world when we're trying to talk about that, and then some of the attitudes to some of the work people were trying to do within the vaccines as well, which are sometimes more difficult to explain to people. So I sort of wondered if we could move on to sort of talking about the systems and the sustainability side of it all, and what structural changes do you think are needed to create a sustainable healthcare environment rather than a reactive one?
Hmm. Well, that's a very big question, right?
I know,
Uh,
only two big questions.
yeah. uh, I think that, looking from a systemic perspective, which is how change happens, right? Of course, there's behavioral and social change, but if the system isn't aligned, if the component parts aren't at the table, then that kind of change is not going to take place. So the conversation is about, patient care quality outcomes that are then supported by the economics and how you realign the economics, how you realign funding to actually be efficient and waste and resources need to be leveraged, and frankly metrics need to constantly be there for accountability. We have to measure to know, and I think that I'm seeing a bit more of that because that's the formula to actually measure what where we're going. And who cares, right? Who cares? Well, patients care, systems care, frontline healthcare workers certainly care because they're living it every day. So I think that that kind of social change is ultimately what the world is asking for, and the systems are the large ships that are slow to turn, but they are coming around.
Because obviously I was thinking about, how staffing levels and the shift patterns and sort of the various resources that are available influence the long-term resilience of the team. Because, if you've got somebody who keeps going off sick all the time, even if they're part of your team, then much as you love them, you are beginning to get strained by it.
Well, to that point, worker productivity, right, is measured. Every public or private system measures that, and those are real numbers, right? And that should tell a very clear, quite story quite quickly. And then there's just the understanding of community and how we look after each other, and those metrics might not be always numerical, but there are other ways to um, understand and change those kind of actions and behaviors. So there's a behavioral response, there's an economic response, but it's about the common conversation. Um, yeah.
So one of the final questions on this point that
Mm.
I wrote was sort of, we talk about culture and you talk about how it plays into this. And I can see that totally. Having worked in international trade all my life, I can see culture's always there, whether how the decision's making. But I'm also wondering whether the culture is sometimes protecting people, but also sometimes undermining the mental health of the people because this whole we expect people to be strong and brave and stoic is a English word that doesn't translate quite so well around the world. But that whole, stiff upper lip, we're feeling great. No, 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 we're fine. Don't you worry about us. I wonder how that cultural plays into whether or not we're really helping people's mental health.
Well, it's a very good point. I think that, you don't have to look far in each country culture to look at how does religion play a role, right? How does it repress or enhance one's understanding and talking about the reality of their condition? If it's a culture that or a religion that sort of represses the acknowledgement of what mental health and wellness is, and not seen as a integral to overall health and sustainability, but viewed as weakness, well, those countries are going to move much more slowly. The
Yeah,
problems will continue, and the stresses, the redundancies will continue, and it's there are
the
statistics
problem.
all that
Yeah.
that tell that story, and it is a problem.
Yeah. So that
Mhm.
sort of neatly takes me into sort of some of the ethical and economic uh, impressions that we have, or the imperatives that drive things. You explained to us how healthcare as an ethical responsibility and an economic priority. Can you expand on how investing in workforce well-being delivers long-term social and financial benefits?
Well, I think that I mean, any ministry of health today, any system of care understands, the numbers, right? They're looking at their budgets. They're either, enhancing, holding, questioning, figuring out what they're going to do. There is no formula or set plan. But the important bit is that the questions being asked. And and truly the bottom line is when you can't serve patients. You can't serve patients because you have people that are dropping out or too stressed to operate. And there is a direct impact that's measurable. I think there's been studies done in most professional organizations, whether it's doctors, psychologists, social workers, all of the professional associations that actually have the data for their professions. It's very consistent. It's very consistent. And it comes back to understanding transparency of um, talking about what's actually going on and not repressing it, and then saying, so what? What are we doing about it? And that
Right.
takes us back to the impact of training, the accessibility, and the quality of training. Because if you don't have a place to fill that need, and for instance, if you're any kind of healthcare professional on the front line, you're worried if you take time to train, even if it's offered you, you'll lose in your job. So it needs to be a top down directive that you will be not penalized, but supported for going and getting that help. Because
Yeah.
in the long term, statistically and practically, that's going to keep you in the game, operating and providing a higher quality of care for patients.
And of course, the final sort of question on that point is, how should governments balance the immediate healthcare demands with the longer term investment in that prevention of the workforce burnout or building their sustainability?
Um, it has to be all part of the same conversation. These
Yeah.
are all factors that have to be considered, and there is data and metrics to support. Um, so the advocacy piece can never be undervalued.
No.
Think with communication in the world today, how we communicate as consumers and patients, and we have access to data. The conversations with our providers, our doctors, our practitioners have changed. It's much more of a dialogue. There's
Yeah.
more information. We have a more educated patient and consumer base. So that has changed the conversation. And that is reflected in how one prioritizes. If
Mm.
you're looking at, time spent, um, pounds spent in supporting one's community. So it is a greater conversation. It's slow. It's never fast enough, but it is, I see, moving forward. So I think one needs to step back and look at the bigger picture, but not take one's foot off the pedal.
No, absolutely. And
Mm.
I should say at this point that we're going to spend a little bit of time on any questions that anyone has. So if you want to put them in the chat, by all means do, or we can we can just chat if you'd sooner voice your question. Oh dear, excuse me.
Yeah, happy to.
One last sort of closing reflection.
Mm.
That question is quite simply sort of looking ahead, what would success look like in, say, 5, 10 years' time for healthcare workforce as far as their well-being is concerned?
Well, that's the big question, isn't it? That is the question. And I think that it's kind of personal for me, from this perspective, it's sort of my hope and commitment in this. I can't separate how I view this, but it's also substantiated everywhere I have been or continue to in terms of health policy influence and any economic guidance. I think we will see a fundamental change when sort of there's this recognition, but continued sort of grace and gratitude given to healthcare workers globally. That is a very real conversation. There is a recognition and of I think literally grace and gratitude to frontline healthcare workers. And sustaining that and taking it deeper is
Amazing.
truly amazing. I think advocacy and clarity for healthcare leaders in ministries of health, chief executives of hospitals, rural clinics, understanding that the benefit to patients and consumers and, frankly, civil society is all about that. It's how we choose to behave, how we direct the resources to support it. And, gee, not surprising that you'll have improved health outcomes. And there is a direct line. There is an economic efficiency to understanding that and a moral and sort of ethical priority to take care and support of those who take care of us. That is what healthcare provision is all about. So I hope that this is not easy, but I think that conversation is absolutely in in the atmosphere and in more conversations. And then if all the institutional supports, training, etc., will support that and be sustained to support that, we will see that kind of change that will make all the difference in the world because tomorrow is a new pandemic waiting.
Yeah. Thank you so much, Linda. Thank you very much indeed. We've got a question from Caroline Brooks, and she simply asks, do you think we've seen the full effects of COVID-19 pandemic on healthcare workers in the UK in terms of their mental health, or do you expect more impacts to emerge over the longer term?
Well, there's a split discussion on this. I think, the practitioners in particular, there's so much we don't know, right? There is the COVID was new, devastating, overtook, the world. And the effects of that, long COVID, other terms of effects that frankly have not yet been identified, but people there's still effects that just we don't yet know. So research needs to be sustained so we do get to the bottom of it. So not only can we treat people with, by example, long COVID, whatever that means,
Mm.
is there will be, some positive results, or at least an understanding of what that total impact can be. Because
Mm.
there was a full range of very lightly affected to, of course, many that lost their lives and everything in between. So many lessons to be learned, and we're really at the beginning of that. is
Yeah.
what I've seen. Mm.
Absolutely. No, I agree. And I also always am very pleased when I'm over in America and somebody turns up and they wear their uniforms. And everyone says like, oh, we'll let him go first and we'll treat that. And I wonder whether we should start looking at more and more, in terms of how we can support our healthcare workers and yes, clapping once a week was a great idea, but it's not enough, is it? We really they need to feel valued. We've got a little comment here that from Fernanda Claudio, and it says, "Thank you, Dr. McGoldrick. There appears to be a trend away from teaching social medicine in training programs, which creates awareness of the role of systems, contexts, and circumstances in which doctors find themselves. Beyond individual action and responsibility, would a return to this be one of the systemic responses to creating resilience in individual doctors and awareness in systems?"
I'm not sure what the question is, but
Well, it's not. I think I think
I
she's saying
very
going back to
helpful.
these older ways of actually,
Mm.
building this awareness. It's probably my fault. I didn't read it terribly well. I've got to.
No. It's a very thoughtful comment, and I think that there is a component of getting back to the basics, right? What did in the relational, literally the relationship between provider and patient was much more intimate, right? It was about knowing one's, not just having 10 minutes to go in, barely talk, assess, diagnose, write a prescription, and leave. So I'd like to think, I don't know this and I haven't seen real data, but I think that there is a sort of social awareness that what good care is. So I think that aspirationally, but practically too, we all know what that looks like, right? If we're really honest about it. So how do we, if say one piece of that is, how does the system, the hospital, the practice of the ethos of this require and expect longer appointments, longer time? What is the criteria of that time in relationship with patients, whether it's just a 6 month or annual checkup, or if it's for a specific need or a very acute need, right, of infectious disease versus no identifying symptoms. So I
Yeah.
think that whether it's rare diseases, chronic disease, just recognizing patients for their total um, health and wellness is really kind of the direction I see us going. And that is maybe to the person commenting about a bit of the good back to basics.
Yeah, yes. I mean, unfortunately, I'm old enough to remember matrons when we used to have matrons in the NHS, and they really did sort of seem to make a huge difference, and we felt a lot more protected and looked after. And of course, the whole point within the UK of the NHS is not
Mm,
just to keep caring about the people that are looking after us, but also remembering that the people can be more productive if they're not in pain and they're not worrying about things. So I think this is it's almost like we need to understand each other and how we should all work.
mm.
Are there any other questions? Because I think that's been excellent. So appreciated your time, Linda. Dr. McGoldrick is like gold dust. We're very lucky to have her with us for today. And we're very lucky to have her as part of our board. And hopefully, if anybody has any questions, come back to us. We will be posting this video online, and we'll also happily make up. So, excuse me, some blogs and things like that to hopefully support this too. But if anybody wants to get involved or has any further comment, please do come back to us because we're fascinated and we want this to be a real conversation, not just between Linda and I.
Yeah, well, I thank you all, and thank you, Lesley. It's very lovely. And of course, I'm passionate about this, as I would think we all would be. So
Thank you very much
thank
indeed.
you. Thank you all.
No, thank you very much. Thanks. And I think oh, thank you for the applause. That's lovely. Very lovely. Thank you very much indeed.
Mm.
And have a good day.
I,
Celebrate your various bank holidays.
yes, yes.
Thank you.
Lovely. Thank
Bye
you
then.
all.
Bye.